done wrongly has its consequences. And then the second portion of this training is using photographs. As I mentioned earlier, I take a photograph of a tissue, and then what I do is I show them the different path the blade can make to create slivers. And then I teach them that first, then I take a clean photograph without these lines, and I have them with a pen draw the line to imagine where they would cut, so they can start visualizing what needs to be separated and how. And on the right hand side are slivers, so they know what they're doing. And the next one would be graft dissection. And I take so they can understand what follicular units is and how many hairs they can guess will be in each follicular unit. I show the difference between single follicular units and difollicular units. We use 2 follicular units grafts, so I use that to teach them. And then I also I start introducing critical thinking. Whether they're cutting foam or they're working with a photograph, I always engage them in thinking. So I would ask, let's say if they're cutting foam, if the foam is cut in pieces that are not even thickness, I would ask them to think about what was the position of their blade to cause unevenness and how they would correct. So there's a little interaction that happens between us. Then I also, as I take a piece of so this is a foam, they're going to cut in even pieces. Then I take that piece, which represents a sliver, and ask them to cut in 5 thin pieces that represents graft. I don't do 4 because it's easy to cut 2 and 2. I intentionally ask them to cut 4, so they have to start developing a size in their mental eye, what would be even sizing, because at the end they have to create grafts that are clean in approximately even size. And we also always talk about poor quality, good quality. This is a picture that I show them to see the difference between transected graft versus clean graft. They also show an image of what hydrated graft looks like. It's moist, shiny, plump, and then there is the graft that dried out, and drying out is a little bit kind of dull, and then dried out is totally shriveled. Interestingly enough, I find that if they are not hydrating grafts often enough, they just lose that little shyness to them, and that is what you have to monitor. So once in a while you can walk through the room and look whether their grafts on the hand or whether they're still shiny. So that will be, you don't have to be there all the time, but you have to be aware what to look for. You will rarely see a graft like the one on the far right, totally dried out. You will see something that is just slightly losing the shyness. So you have to. And then in my test, what I also do at the end, I give them an image of these ugly grafts, and then I ask them to imagine how many grafts they can salvage from this. And then we come up with numbers so they can understand. I want to see that they understood what I taught them. And this is just to recap why 2-phase training, because I want them to get familiarized with the subject and also to have opportunity to talk about things before they see the patient, develop stamina and skills, and decrease stress in the length of a learning process. You're aware of the book that we proudly wrote, and there will be, this book will cover all that surgical assistant, all her assistant's task. Also, it will cover a little bit of history of hair restoration, hair biology, things that the surgical assistant should know to be able to educate a patient, and also good quality grafts in a technique. So you can either give this to your assistant to read and learn from it, or you can read it and train your assistant with it.